In this video, we will be decoding the cancer journey of Chadwick Boseman. Now, the question really is, how does someone who is young, athletic, seemingly healthy end up with a cancer diagnosis and end up passing away by the age of 43, only 3 to 4 years after his initial diagnosis? He is best known for his role in Black Panther. When he passed away in 2020, it was a shock to many people because he did not want anyone to know. And I don't blame him. I feel like when you have a cancer diagnosis, people walk on eggshells, they don't know how to react, and maybe he wouldn't even got the role if he told everyone that he had cancer. So for him to reach out for help, I am not sure what he did in his cancering process, but in this video, I want to go through the top 3 things that I would want to be screening for and how I would take more of a metabolic approach to his cancer care. One of the common hereditary genetic factors that play a role in colon cancer is having something called Lynch syndrome. It is actually the most common cause of hereditary colon cancer. You commonly see Lynch syndrome in people who are diagnosed with a cancering process under the ages of 50. Now, before I get into the 3 things that I would do to support someone with colon cancer and reducing risk, is making sure that you know the warning signs. So if you have drastic weight loss, if you have a change in your bowel movements, if you have unexplained anemia, lower energy, or blood in your stool, those are all early signs that you need to get checked out. And there's no harm in having a colonoscopy done, something that can see if there's precancerous polyps. Having an annual screening can actually prevent you from this cancering process progressing at a faster rate. Now, if you're looking for alternatives to the drink that you have to take before a colonoscopy that completely destroys your microbiome, make sure to connect with me at drlori.ca and I can help you with many options that preserves your gut health and screens for these types of cancers and can also help you implement a plan to support you in your cancer journey. So if Chadwick Boseman was my patient, I would make sure to do a thorough stool assessment for him. So this is not just sending away a bowel movement to a lab and just to see if there's blood or parasites. The type of testing that I like to do is a lot more comprehensive. So we take a stool sample and the lab can let us know about the good bacteria in the gut, the one that really helps support a healthy microbiome and immune system, and then also looking to see what type of abnormal bacteria is in the gut. There's a specific type of bacterial overgrowth called Bacteroides fragilis that can drastically cause more inflammation and increase risk for colon cancer. So inflammation in the colon can be exacerbated by deep fried foods, by processed red meats, a low fiber diet, high alcohol intake, and a low antioxidant status. So low vitamin C, folic acid, selenium, and zinc. There's actually a direct correlation between how many vegetables you have in your diet and how many phytonutrients and lowering cancer risk. You want to stay away from the trans fats, the deep fried foods, and actually increase the healthy fats like the omega-3s, which are in avocado, coconut oil, and olive oil. They have a very protective effect on lowering inflammation in the body, and actually every cell membrane in your system is covered by a fatty lipid layer. So for not just colon health, but for every cell in your body to communicate effectively, you need to have a certain amount of these healthy fats. Now, it's interesting because of the many patients who have had colorectal cancer in my practice, actually none of them were male and none of them were heavy meat eaters, none of them smoked, none of them had a lot of alcohol, and it was very interesting of why did this young 40-year-old or late 30-year-old have colon cancer when all of those risk factors were not there. So it's very common to have a diagnosis and be completely confused of why did this cancer even happen in the first place. The second important thing that I would make sure to check out is what your hormone status looks like. The colon is rich in estrogen receptors, and if you have an abundance of estrogen not broken down in the system, this can absolutely increase your risk for colon cancer. So when you think of Chadwick, for example, when he's a busy actor, he's go, 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 maybe sleep was compromised, maybe diet wasn't so great, you look at all the things that can contribute to cancer's growth, it would have been even more important for him to deep dive into nutrition, circadian rhythm, how to balance stress, and how he can live his healthiest life despite having this diagnosis. And when you are under continual stress and you're go, go, go all the time, what happens is your body starts to steal from this sex hormone. So if he did not have regulated sex hormones and cortisol's way out of whack, then I'm really hoping that whoever he was seeing as a health practitioner was really focusing on his adrenal glands and supporting how his body released cortisol and dealt with stress, just knowing how stressful his lifestyle must have been. If you're looking for a practitioner to deep dive into your cancer care, please go to drlori.ca and I would love to help you integrate your cancer care plan. The third really common part of colon cancer and ways that you can control is growth is having blood work done looking for fasting insulin and IGF-2. These are both growth factors that need to be as low as possible. When you are a young child and you're growing, it's very common for these growth factors to be higher because that's an important part of growing up. But as an adult, there's no need to have elevated IGF-1, IGF-2, or insulin. One of my favorite ways to control insulin production is by intermittent fasting. Thousands of studies out there showing how just limiting the hours that you're eating in the day can have a protective effect of not only glucose intake and how often the glucose is being spiked, but as a result, how often the insulin is being spiked and driving this cancering process. So a really important part of anyone's treatment plan undergoing colorectal cancer therapy is to have these tests monitored and every single month making adjustments to your lifestyle, to your diet, to your overall plan until these levels look optimal, healthy, and normal. And this is very possible. I see this all the time, especially when we get your genetics back. We can see how well does your body break up sugar, how does it break up fat and protein, what type of specific meal plan should you be on to make sure that you have the best outcome. I hope you join me in my next video where we deep dive into Selena Gomez's journey with lupus and all the ways that she can support her immune system during this process.